What is the most effective way to recover from a hip replacement? Early movement and exercise is crucial for recovery. However, not all exercises are safe, which is exactly why you need skilled physical therapy. As a physical therapist, I've successfully treated over 100 patients who've undergone hip replacement surgery. In this video, I'll teach you essential weekly exercises used in the first month of rehab. Let's get started. Ankle pumps will be the very first exercise. You can start doing this on the same day as surgery. So what you want to do is you want to point your foot down and up. So it's going to be that gas pedal movement. So we want to get that circulation going to help with the swelling. And essentially you can do this throughout the day, 10 to 20 times at a time. Butt squeezes or glute squeezes are exercises that you want to start on the next day after surgery. So after surgery, some of these hip muscles are going to be turned off essentially. So we want to just get them activated and turned on again. So all you're going to do is just squeeze your butt muscles. You don't have to raise your hips off of the bed. You just want to squeeze them together, hold, and relax. Thigh squeezes will help turn on your quads after the surgery. So again, you want to start this exercise the day after surgery. So all you're going to do is almost press your knee down towards the bed. So you're going to be squeezing your thigh muscle. Hold for a 3-second hold and then relax. Heel slides are going to help us start to get some light range of motion to improve some of the mobility at the hip and the knee. So what you want to do here is you're essentially sliding your foot and your heel down the bed to straighten out your leg and then back up. So you just want to keep in mind the hip precaution in terms of not bending your hip past 90 degrees. So as long as you stay within that less than 90 degrees at the hip, then you're going to be safe with this movement. Straight leg raise is the exercise that you can start 1 or 2 days after surgery, depending on your pain levels. So what you want to do is straighten out your leg, squeeze that thigh, and you're not going to initially lift up as high as I am in this video. So I want you just to lift to your tolerance. It's not going to feel comfortable at first. So just work in a range where you can just feel that thigh, that quad tighten, and trying to keep the leg straight as you lift it. Seated leg kicks will also be important to work on turning on that quad muscle of your thigh, as well as working on a little bit of mobility. So all you have to do is sit at the edge of the bed or the couch and try to kick out your foot as far as you comfortably can. Initially, you're not going to go where your knee is fully straight, but you can build up to that. So you're just kicking out as far as you can tolerate. I included sit to stands just to show you the correct form when you're standing or sitting down. So you want to have the leg kicked out in front of you to avoid putting too much weight on that leg while also avoiding bending too much past 90 degrees at the hip. For the first week after surgery, it is best practice to try to avoid using chairs or couches that are sitting very low, just to make it a little bit easier to stand up and sit down. By week 2, double leg heel raises are added. You could start these a little earlier as 2 to 3 days after surgery, but by week 2, this is a safe exercise to add. So essentially, you're going to be using a walker or the wall, and you're just going to go up on the toes and back down nice and controlled. Standing hamstring curls will be added as well to work on some of that range of motion as well as the hamstring strength. So all you're going to do is stand against a wall or use the walker and try to bend that knee as far as comfortably and then work your way to increase the range of motion. At week 3, standing side kicks are also added to work a little bit more on single leg stability. So you'll be standing next to your walker or by the wall just for a little bit of stability. And you're just going to kick your leg out to the side, just a small amount, and you want to go at a slow, controlled pace. By week 4, we want to start progressing the hip flexor strength. So we'll start adding in standing marching. So all you're going to do is stand next to your walker or the wall and then alternate left and right marching. Mini squats are also added, so when you practice this, you don't have to use a low chair. Ideally, starting off with a higher chair is better.